Okay, so this is a great spinal stretch. So you're gonna start on your back. Especially if you're feeling tight, you're just gonna kind of start wiggling your knees side to side, because we're going to create a certain amount of pressure in the spine, and we can use it to stretch if we go slow. If you go fast, it can hurt. So this is all gonna be about kind of doing a little bit at a time and sort of unwinding things. So you're going to start with just kind of shaking your knees side to side, gently, slower, a little slower than this. And then you're going to bring your knees up to your chest. And if you start to feel pressure in your back or pain, then this is where you stop. If you don't feel anything, great. You're going to bring your legs up a little bit and just start to tip your hips back towards your head. Once you find a place in your spine that feels tight, which will happen pretty quickly, just stay here, take a few breaths. You're not increasing anything yet. You're just finding the spot that feels uncomfortable, and you're stopping there and giving yourself a chance to stretch around it. As you go higher, it's going to be harder to breathe. So then once you spend a little time there and stretch it out, roll everything down nice and slow, legs come down, shift the hips side to side again. This is also going to kind of lift and move your butt so that your spine is going to get longer.
Mm-hmm.
So as you lift and shift and move around, you're going to start over again. Knees come up. Look for the next spot that feels uncomfortable. Legs are going to, and you're eventually looking to get your legs kind of straightish. If you get any sciatica tingling or anything tingling in your legs, or just bend your knees a little bit more. You don't need the legs straight. Bring them up a little bit higher. Find a spot that feels uncomfortable. Breathe into it a few times. Honestly, the longer is better. If you can do 5 to 10 breaths. And you may feel it ease up. Cool. If it eases up, absolutely great. Come all the way down, nice and slow, roll down. Knees side to side, gently, slowly, a little slower than this. Just to kind of loosen things up and get your breath back. Because you can, when you get to spots that feel really tender or painful, it's going to be hard to breathe. Your body's not going to want to stay there. You might even feel kind of a pulling at the back of your skull, because what we're stretching is all the structures inside the spine, and those things go up into the brain. So if you feel a headache, if you feel pressure, stop there, breathe, breathe, breathe. It will get better. It will go away. Come down. Eventually, you're going to get up to the point where your legs are coming up basically to the floor behind you. Once you get there, you may be in a spot that feels uncomfortable, or you might not. From here, it's a slow roll down. And as you slowly roll down, just like in Pilates, you're kind of putting one vertebrae on the floor at a time. Oof! You're going to find one that sucks. You're going to breathe and relax. Trying to stay in that spot that hurts. Just enough that you can kind of slowly relax it down. Slowly open it up with your breath. When it feels bearable, move on. You can keep doing this one step down at a time, or you can just decide, I'm done with that roll. We're going to come down. We're going to loosen up. We're going to take a little side to side. And then we're going to do it again. You will find that spot in your back will show up for you. That spot that feels tight, you will find it, and it will take your breath away. And you will go, ow, that's horrible. Give it 3 breaths, roll down, and go back to it. Every time you go back, it will get easier, and then you'll stand up, and it will feel amazing.